One of the biggest things that can be done with patients, one of the most important, I believe, is trying to floss the thoracic nerve roots. Now, I like to teach people how to do this at home, and when they do it at home, they're not going to be able to isolate a particular thing. As the doctor, you can isolate it in a different manner, but for patient work, this is what we're going to do. So I'm going to have the person in a sideline position. I have them do this on their own bed. I'm going to do it here on my treatment table. Now, a couple things to note. This arm has to be flat. And the reason for that flatness is that the head needs to be able to come back. So we're going to be bringing the head back like this. Now, in the front, I'm going to take and I'm going to make a fist, and I'm going to keep my elbows straight. I'm going to put this on the table in front of me. Now, the job of the elbow is to go forward. So this is how we're getting the movement in the thoracic spine. At the same time this goes forward, the head needs to come back. So this is a coordinated thing. And what you can do in order to measure this on the patient is have them sitting, lean over, assess rounding in the thoracic spine. You will find flattened areas. After doing this, if you reassess that, those flattened areas will be less. So here we go. This is what it looks like. It's very important in the process of doing this that they not lift their head up. We want the head to just kind of travel right along the arm without any lifting up or tightening of the muscles on the top section. So this is a very, very easy thing for people to do, and it also has a really nice effect on the long thoracic nerve where we did the chicken dance before. So this is the first way to do it. Now there is another way to add to this and get that long thoracic nerve, and we want to do that because the dermatomes are coming around this way for the thoracic nerves, but the nerve supply underneath for your serratus and your lat is the long thoracic nerve. So I'm going to come down a little bit lower here to give myself room. My hand is in the same place. Now I'm going to put my fist and I'm going to move my elbow up. And I'm going to do the same motion where I go forward while bringing the head back. So this way we're getting the long thoracic nerve at the same time where we've also just had a really nice effect on the thoracic nerves as they come out. These are things that, again, patients find easy to do if they can get into the position. They may not be able to get here. Their lat position may be here. You do what you can do. Thank you very much.